Well, welcome everybody, and welcome to Ask the Expert. I'm Dr. Tom, and with Dr. Tom Cosmetic Surgery. And today I'm really excited because we have a returning guest. We have Jessica Allen, who is our nurse. Hello, Jess.
Hi, Dr. Tom. Glad to be here. Thank you for having me.
It's great to have you here. And so, we have a great team, and you're part of it, and I really appreciate you being part of it. What do you do for us at Dr. Tom Cosmetic Surgery?
Yes, I am the surgical nurse, and I'm also our cosmetic laser nurse specialist.
Okay, so you help us in surgery.
I do.
Absolutely. You're the best friend of our patients. You're giving them head massages while we're doing procedures under local.
That's
fantastic. And then you're also, I love that, you are our cosmetic laser nurse specialist.
Yes.
What do you like about being a cosmetic laser nurse specialist?
I really like helping people build confidence in their appearance, help them, look at their skin, find a good skincare treatment plan that helps them to look their best and feel their best.
Okay, well, that's great. So today, for those who are listening, we thank you always for listening. That we were very fortunate back in 2000 when I started what was initially called the Aesthetic Laser and Vein Center, and now known as Dr. Tom Cosmetic Surgery. I was actually the first doctor here in the Sonoma County area to introduce IPL, intense pulse light, or what is known as photofacials. I was lucky enough, Jess, I went down to Los Gatos, and I worked with Dr. Bitter Sr., and he was one of the founders along with his son, Dr. Bitter Jr. That's funny how that happens. And I learned their technique and brought it here, and it has been, in my opinion, one of the best treatments that we offer in terms of healthy skin.
Yes.
And even in some of the meetings with our staff meetings, I will say often that if we all had an IPL every 4 to 6 weeks, that our skin would be super healthy and look phenomenal.
Yes, I definitely agree with that.
Right. So we've had IPL and we still have it, and it's good for certain types of cases, but always looking for the latest and greatest, but something that is I'm going to see supported or backed up by really scientific results. I was very excited to bring a new technology in photofacial therapy called BBL, and was so excited to have you be part of just launching that program here in Sonoma County. So, Jess, BBL, what is BBL?
Yes, so BBL is in the same class of treatment as IPL, but it stands for BroadBand Light. So it is the more advanced and efficient technology in photofacials. It's a lot safer to the patient, it's faster, and a lot of patients really like how effective it is.
Okay, so you mentioned how effective it is, and so we bring in a new technology, and I like the way that you described it as more advanced and refined form of IPL. Actually, if you wanted to get into the techno, kind of the nerdy part of it, which I can easily do, the BBL actually has 2 IPL heads in it, but the technology is able to deliver with, I'm going to say, less intensity, an effective treatment, because you mentioned that patients like it for its effectiveness. How about in terms of comfort level?
A lot more comfortable. It's faster because it pulses a lot quicker. You can do instantaneous pulses, and it is just a more comfortable treatment. It's still packing that punch. It's just not as spicy as the IPL.
Right. So being a guy, being a surgeon, if one's good, 100's better, and you're kind of thinking, no pain, no gain. So that's not true with BBL.
It still can have, it's hot and snappy, so it feels like a little bit like a rubber band snapping your skin, but it is comfortable and very, very tolerable for the patients.
Right. And I know that, I trust you so much that actually you treat my wife.
I do.
Yes.
Yes, I do.
And so, she's trained actually in the past, a lot of our nurses, she's the guinea bunny. And so she comes in, she's blonde hair, blue eyed. And so she comes in and she gets her treatments with new staff and ongoing staff. And she's been your patient now for about 3 years, it seems like, right?
Yes.
And so Jess, what has been her feedback to you in terms of the effectiveness and the comfort level of the BBL over the IPL?
Right. It's there. So there is you can really customize and tailor the treatment based on the patient's comfort, but also you can see the efficacy, and you're looking for certain endpoints in the skin when you're treating, but you're also able to really fine tune the settings to make it the most effective treatment for the patient and also the most tolerable for the patient. So based on how the patient is feeling that day, we adjust the settings so that they are having a comfortable treatment, but also very, very effective.
Okay, so for a lot of our listeners who've been listening to us for over 20, it seems like 20 years on KSRO Ask the Expert, they've heard about photofacials or IPL and now BBL, but for those who may be just tuning in, or by the way, we do post these shows, our live shows. We post them on YouTube, so you can listen on YouTube if you want to go there in a day or so. Will be posted under Dr. Walter Tom channel. Jess, who are candidates for BBL? Somebody out there might say, well, Dr. Tom said it makes your skin healthy,
Yes.
but what exactly am I treating?
Right. So
Okay.
BBL is treating sun damaged skin, hyperpigmentation. It's also very effective at treating redness in the skin, patients that have rosacea, those little broken capillaries that we see on the skin. So it's really targeting pigmentary concerns in the skin and giving a more even tone complexion. It also is really a nice rejuvenating treatment that makes the skin appear more youthful.
And that's great. You mentioned treating rosacea, or
Yes.
which is redness, ruddiness, kind of
Yes.
flushing.
Yes.
And I know a million years ago, one of the English medical journals called The Lancet described rosacea as being the socially most embarrassing disease. And
Yes.
so people who have that are very embarrassed because they feel when they get flushed or red that, oh yeah, I look like I'm embarrassed and I'm not, or that they look like they're drinkers. I'm an alcoholic. They think I'm an
Yes.
alcoholic. And so it's very bothersome to those
It
patients.
is very bothersome, and this is it's really one of the gold standard treatments for people that have that redness in their skin, the flushed cheeks, the red nose, and those little broken capillaries. It does a really nice job of toning all that redness down in the skin so they have a more even complexion and they have more confidence.
So I love that you came to this sort of the same conclusion. It's interesting, I described when I brought IPL to Sonoma County in the year 2000, holy cow, that I went down with the Dr. Bidders, who were dermatologists, and when they developed it or started to adopt this technology, they were very excited about it for treating rosacea. And then as they treated for rosacea and were getting nice results, they were finding that it was also good for other things cosmetically.
Yes.
So what might the patients feel who don't have rosacea? What are some of the other cosmetic benefits?
It gives a really nice tight and toned appearance to the skin. The skin looks more glowy. It's helping to target those little brown spots that we see on the skin, the hyperpigmentation. So the skin just looks overall tight, toned, more youthful, and just really rejuvenated.
Okay, so hence the name Photorejuvenation
Yes,
or
yes.
photofacial. And so you mentioned the brown spots, and that's something that I'd like to maybe spend a little more time on. You
Yes.
kind of went over that one kind of quickly. Hyperpigmentation, or what we call sunspots or
Yes.
age spots, it can be very effective for that as well.
Absolutely.
So in terms of ethnicities, I made a point in describing the fact that when you treated my wife, that she was blonde hair, blue-eyed, and
Yes.
I'm Chinese and Greek, okay?
Right.
And just got back from our Maui Cosmetic Surgery week, so I'm a little bit darker than I should be.
Yes.
Who are good candidates for the BBL treatment?
Right. So good candidates are going to be patients that are fairer skin, usually treat very well with BBL. Our darker skin tones, we do have to be a little bit more cautious, but they still can be treatable. You want to not have a fresh tan, Dr. Tom, so you wouldn't be a good candidate to get one right now.
Right.
But you want to have more of a fair complexion with hyperpigmentation spots or redness. So we do consultations with our patients to see if they're a good candidate. Depending on their skin type, sometimes treating a patient in the fall or winter months might be more appropriate for certain skin types.
Got it. So so I'm going to say Northern European skin types for sure are great
Absolutely.
candidates, right?
Yes.
Okay. But we do ask about ethnicities quite a bit because you never know that somebody who looks totally Irish might have some African blood
That's
in them,
very
right?
true.
We don't know that. And so they're good candidates. And so someone like me, or let's say a Latina, who's looking for for treatment, we may notice some age spots. Okay,
Yes.
certainly, a lot of times we see as a subgroup Latinos who work in a bank versus Latinos who might work in the vineyard, for
Right.
instance, and that they have
More
the ones who work, they
hyperpigment-
have more hyperpigmentation.
Yes.
What kind of preparation do you recommend for people like that, or for me?
Yes, so there are a few different things that you can do. Chemical peels are a great way to start. You can help to lift some of that hyperpigmentation and shed the superficial layers of the skin. Additionally, an ingredient that we like to use in some of our skincare products called hydroquinone. It's a prescription strength product that helps to calm down the melanocytes and make the skin more light in tone, so it's safer to treat with BBL.
Okay, so the key is we want the skin to be lighter, okay?
Lighter,
And
yes.
why do we need to do that if we're getting a BBL and it's supposed to be treating pigmentation? Why do we need to do that?
Well, we want the light to differentiate between the tan, natural tone skin and the damaged hyperpigmentation or the sun damage.
Okay.
So having the skin be as light as possible helps the light to focus on the targeted areas that we're looking to treat.
Right. And if you go to, I'm looking now directly into the camera and talking to our YouTube audience as well as our KSRO Ask the Expert audience, that we always want to do what's safest for our patients. And so coming to a doctor's office like ours, okay, that we actually review cases together.
That's right.
And that we always are going to be conservative. We want to get the best result for you, but we don't want you to have any untoward effects. And so
Right.
if you're tan or if your skin's a little too dark, if you maybe have African American blood, for instance, and so
Yes.
forth, that we don't want to leave you with some permanent lightening of the
That's
skin.
right,
So
hypopigmentation.
hypopigmentation. So we are
Pre-treatment.
very we stress very much pre-treatment. Okay.
That's right.
So you mentioned sometimes a peel that we have them do that. And what type of skincare might be good for this kind of preparation for the treatment?
Yes, so preparation, you definitely do not want to be on any retinol products going into a BBL treatment. So you would want to stop taking the retinol for about a week before your treatment. You want to use very gentle skincare products. Certain medications that cause photosensitivity are also, it's advised to stop those about a week before treatment. But the pre-treatment for skin sometimes is a course of using hydroquinone and prepping the skin before going through with the actual BBL treatment.
Okay, so what the hydroquinone does, you mentioned that it does what?
It helps
again?
to lighten the skin, the natural skin tone, so
Okay.
that
All right,
is-
and I think you mentioned the melanocytes or the...
it helps to calm the melanocytes.
Right, those are the cells that create the pigment in
That's
our
right.
skin, and so we want to kind of calm that down.
That's
and,
right.
and sometimes our patients, like me, we're a little impatient, or well, treat me now, and so you would turn me away right now?
I would turn you away right now, Dr.
Right
Tom.
now,
You're too
okay.
tan, and we
Okay.
would need to be
All right,
safe.
so bad on me, bad boy. Okay, so in terms of preparation for this, what should a patient do besides avoiding medications that make them hypersensitive to the sun?
They're going to avoid the sun.
Okay.
You do want to avoid getting intentional sun exposure.
Okay.
And you also want to avoid using self-tanning products because that is putting pigment on the skin. So that would not be something you'd want to use.
Right. So actually, I always use sort of a cartoon character is
I know.
the best candidate is actually Snow White, right?
That's right.
Because Snow White has that white skin. She has dark hair. So by the way, does the BBL help to reduce hair growth?
It can.
It can,
definitely
right?
can. So
It can.
you might get a little upper lip hair removal during your
With that,
treatment.
right,
Added bonus.
Right, and for guys, then we have to tape off the beard
too.
area, right?
If you do like to have a beard, we do like to protect your beard, and we do block that area off in treatment.
If I was a young virile guy like our producer Jeff and had all that facial hair, I would have to do that. But me, I got that sissy face, and I don't have hardly any facial hair,
You're
I don't have to
perfectly
worry about that.
prepped for
I'm
treatment.
prepped for a treatment. Okay, that's great. So, what is a treatment like? What is a BBL? What is the actual treatment like?
Yeah, so when you come in for treatment, you're going to come in with a clean, dry face, no products on it. I know that can be hard for people, but I promise I won't leave you dry. You come in with a clean, dry face. You're going to be in treatment for about an hour. It feels a little hot and snappy. We use a cool ultrasound gel, and I am adjusting the settings as appropriate. After treatment, we do a nice cool rejuvenation where we put some aloe vera gel and a compress, so we cool the skin down. And really, you're going to expect to feel as if you, a little pink in the cheeks, a little pink in the face for maybe a couple hours post-treatment. Very comfortable, and then we will give you some sun protection for sure. It's about 24-hour downtime, so it's a really minimally invasive treatment. It's a great for people that don't want to have a lot of downtime from a treatment, and you can wear makeup the next day with your gentle skincare regimen.
It's always interesting when we plan a topic for the talk, that I have a patient that shows up and they're talking about that treatment, or they get that treatment. So I was just doing a Botox and a filler patient today, and she's heading off with her daughter to Hawaii in 2 days, and she said, I need to get another BBL, and I was thinking, this isn't just the right time, because you're going to get out into Hawaii. I do protect myself when we're working in Maui, but the sun still gets to us, right?
Very intense.
So we wouldn't have you do it right before you go to Mexico or to Maui or heading out to the beach. Okay, so I kind of smirking and smiling a little bit, because I introduced some 26 years ago, and I'm listening to you to describe the discomfort. We're still using that rubber band snap. Is that what you're describing?
Snappy, a little hot and snappy.
Okay.
It really is the best description.
So a little rubber band snap. And I've been saying that for 26 years. I will have to tell you that just from a personal standpoint of through my wife, who again is blonde hair and blue eyed,
that's right,
that when she describes the difference between the older IPL or older IPL intense pulse light versus the BBL, that it's a world of difference in terms of comfort level.
Yes, I have heard that from most patients that have had both treatments modalities, that the BBL is much more comfortable, much more tolerable, and it just goes by a lot quicker in their minds when getting treatment.
So for those, and especially for patients who've been with us for, today was wonderful. I've had patients who've been with me for 20 plus years, which I love seeing them. They're our friends, right?
They are.
And so when they come in and they've had previous IPLs, and their toes are curling a little bit when they're getting zapped. I know mine once in a while. Our staff is treating me, and I can't be a weenie because I'm the boss, but I'm thinking, oh my God, I'm a weenie here. But when we get these treatments now, how do you explain to those patients now, because they're feeling like, God, this is a weenie treatment. This is like I'm barely feeling it compared to the other treatment. What is their feedback in terms of the results of the BBL to the IPL?
They love it. They do. Sometimes people are like, is this really working? And it is definitely working. It does take time to see the results. It's something that it's using your body's own natural healing response. So you do see your results in 1 to 2 weeks after treatment, and it is definitely effectively treating the skin. It's just not as intense as the IPL used to feel. It was more hot and just was a slower process. Okay. So it definitely is. I can turn it up if necessary, but it is not as spicy as the IPL.
Okay, so not as spicy. Okay, that's our lead Mary's favorite word, is feeling spicy. Okay, so having said that, now having these treatments, and again, thank you for explaining the treatment itself. What do patients do after their BBL treatment? What should we do to maximize our results?
Right. So number one thing, SPF. You want to protect your skin from the sun. Immediately after treatment, you do want to avoid sun exposure, wear sunscreen, wear a hat if possible, and you want to use gentle skincare and allow your skin to heal naturally without trying to use chemical exfoliants or peels or any of that. You're going to let your skin heal naturally. It is a very minimal downtime, but you do want to use more gentle skincare products and just moisturize and support your skin barrier following treatment.
And sun protection.
Sun protection is the number one thing you have to do.
Okay,
yes.
So
protecting your investment. If you are going to invest in the youth of your skin, you want to protect it.
And what if we are in a situation where we need multiple treatments? Well, let me back up. How many treatments, should we expect to get some results?
Yes, so BBL is not a one and done treatment. It is something that we see best results in a series. We usually say around 3 to 5. It's really going to be dependent on the individual patient and the skin concerns and the severity of their skin condition. But typically it's around 3 to 5 treatments.
3 to 5 treatments, and I love what you said. It's not a one and done.
It's not a one and done.
So it's not magic. It's science. It's medicine. And what I tell patients, and this is from when I used to be a general vascular transplant surgeon, if it took a while for a disease to become evident, usually the cure, helping the patient, it takes a while for them to get better.
That's right.
If it happens within 6 hours, like acute appendicitis, and I would go in and remove an inflamed appendix, they're going to get better more quickly.
Right.
So I would say that that's true with skin processes.
Yes.
That it's taken a while for us to get to where we might not like what we see in the mirror.
Right.
And so we go ahead and we have an IP. Excuse me. See, I'm so old. I called it an
It's a
IPL,
BBL.
BBL, right? The BBL. And so when we do the BBL, it's not a one and done. So expect a series of 3 to 5.
Yes, roughly. That's what we say, and it just really depends on the patient and their response.
Right. And so some patients will, in the old days, Jesse said, well, how often do I have to do this? And I said, again, it's patient specific.
That's right.
And but that for some people, maybe they don't have to do a series, but they might come in once every 6 months to have a treatment, or once a year, or we may not see them for several years, and then they come back and see us. So it really just depends on how you respond and your expectations, right?
That's
your
right.
expectations. So
Absolutely.
well, that's really interesting. So thank you for all of that. So what do I need to do? Okay, Dr. Tom came in, he's 210, and we have about a minute left. So what do I need to do to get ready for me to get my BBL with you?
You need to let your tan fade.
Okay.
Perhaps we could give you a peel, or you
Okay.
can prep with some hydroquinone and get
Okay.
your skin nice and light and safe
Okay.
for treatment.
Okay, so I think that's where I'm going to head. That's what I'm going to do. Thank you for coming, and
Thank you
appreciate
for
that. Will you
having
come back
me.
and visit us again?
Thank you for having me,
Thank
of
you,
course.
thank you. So this is Jessica Allen, who is our cosmetic laser nurse specialist, and some of you know her because she's also our operating room nurse,
right.
and has been an invaluable part of our team. I want to thank all of you again for listening to us on KSRO Ask the Expert, and we are very, very honored the fact that you have voted us for 10 years in a row as the best cosmetic surgery office in Sonoma County, and we're waiting for the voting for 2026 to come out, but hopefully we can then brag a little and say for 11 years in a row. So thank you everybody for tuning in. I'm Dr. Tom, and this is Nurse Jessica Allen. Thank you.
Thank
Bye-bye.
you.